focusing on parents' emotional well-being from a cultural lens throughout this month. I am Irina Polanco Ventura, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. The Partnership is a nonprofit agency licensed by the New Jersey Department of Health, and our mission is to meet the healthcare needs of women, infants, and children in Northern New Jersey while coordinating education, outreach, and advocacy through regional planning and collaboration. I'd like to thank the New Jersey Department of Health for funding this speaker series and allowing us to provide essential services to families. And to learn more about our Perinatal Mood Disorders Initiative, which provides support to expectant and new parents, please visit the Partnership's website at pmch.org and click on the Programs tab. So before we get started, I'd like to review some important information. 1 hour after the webinar ends, you will receive an email with a link to a post-program evaluation. Please complete the survey to provide us with feedback on the program. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the Partnership's YouTube channel. We will also be muting all attendees' microphones during the presentation, but we would love to hear from you. So you can write your questions during the talk at any time in the question box, and the speaker will respond to as many as possible at the conclusion of the presentation. Now, I would like to introduce today's speaker. Dr. Olajide Bamashigben is a Nigerian-American health psychologist and professor of psychology at California State University, Long Beach. Born and raised in Miami, he received his bachelor's degree in psychology from the University of Miami and his PhD in psychology from the University of California, Los Angeles in 2017. His research on paternal depression has been published in peer-reviewed research outlets such as Social Science and Medicine, Frontiers in Psychiatry, the American Journal of Men's Health, and on news outlets such as The Today Show and CNN. Dr. Bamashigben has presented his research at conferences such as the Association for Psychological Science, the Western Psychological Association, and the Society of Behavioral Medicine. So before I hand over the program to our speaker, I want to thank you, Dr. Bamashigben, for being with us today to talk about fathers who are essential members of the family unit, yet oftentimes overlooked. Thank you so much.
Awesome. Thank you so much for that introduction. Good afternoon, everybody. It's still morning over here, but I'll say good afternoon because I know most of you are on the East Coast. And I want to thank you so much for having me. I really appreciate you bringing me out. So once again, my name is Dr. Olajide Bamashigben, and I'm an assistant professor of psychology at California State University, Long Beach, and I'm a health psychologist, and I'm excited to talk to you today about risk, resilience, and depression in fathers from diverse backgrounds. Okay. So first, here's a disclosure and commercial support slide that I'll post and just leave up for a little bit. Okay, so now let's get started. All right. So just a brief overview of what we'll talk about today. I'll give you a little background research about fathers. I'll tell you the theoretical framework that guides the work I do. I'll tell you about 2 research projects focused on, one study focused on low-income Black fathers and the other focused on just father involvement in a diverse sample of fathers, and some of my current research projects focused on dads, okay? So let's get started. So background research on dads. So if there's one thing I want you to take away from this talk, okay, it's that fathers are important members of the family unit, all right? So here I am with my dad as a young child, and here I am with my 2 sons, you know, and I know for a fact, just anecdotally, my father played just a huge role in my life. I mean, in addition to my mother, but my father played a huge role in my life, and I hope that I'm here for my kids to play a big role as well, okay? So dads are important, right? And a lot of research shows that but things related to dads, such as their absence, their level of involvement, the way they parent, their mental health, and their health behaviors have impacts on their kids. They have impacts on their kids biologically, psychologically, and socially, right? And we're talking about these impacts on kids can be seen while they're infants, in early childhood, in later childhood, in adolescence, and later on. So, you know, things related to dads have a real impact on kids. However, there's still a big research gap, okay? So we know that, you know, absence, involvement, mental health impact kids, right? But what predicts the absence of fathers? What predicts fathers' involvement? What predicts fathers' mental health, right? Those questions have been researched far less, okay? Because historically, the field of family research and family psychology has excluded dads as participants, or it hasn't included dads as participants. And this is especially true when we're talking about low-income dads or fathers who are Black, Latino, Asian, or Native American, right? There's a lot of the research on families that has included fathers has focused on middle income, high income white fathers, right? So it's really important that we understand more about these fathers who may be more disadvantaged in certain ways, okay? So in this talk, we will discuss how paternal depression impacts the father and the family. We will identify some predictors of depression in low-income Black and Latino fathers. We'll highlight resilience resources that may protect fathers from the negative effects of stress and depression. And we'll talk about some potential solutions that may improve paternal and familial well-being and health. Okay, so the theoretical framework that I use is a risk and resilience framework. Okay, so basically a risk and resilience framework just says that there are risk factors that increase the probability of an outcome happening, right? And there are resilience resources that may decrease the probability of some type of outcome happening, all right? And these resilience resources may also function to reduce the negative impact of the risk factors on the outcome. So the resilience resources can be related to the outcome directly by themselves, but they can also function to help mitigate stress. And also, none of these things are necessarily independent. Risk factors and resilience resources are often related to one another, okay? So the outcome that we're focused on is paternal depression. So what is that, first and foremost? So it's estimated that around 8 to 10% of dads will experience depression during the first year after the birth of their child, okay? That's a lot. And symptoms of depression include depressed or sad mood, loss of interest in most activities, changes in weight gain or eating behavior, changes in sleep, experiencing fatigue, loss of energy. Okay, so these are just some of the things that may happen when a father is depressed. And once again, 8 to 10%, that's a really substantial amount of dads who do experience depression, right? And there's a lot of debate in the field about whether paternal postpartum depression is a thing. I'm not here to weigh in on that, but I do focus on depression in the postpartum period for fathers, which is that first year after the birth of a child. And we know that greater depressive symptoms in dads is associated with less positive parenting behaviors like reading, singing, or playing with your child, more negative parenting behaviors like spanking them, greater father-child conflict, more internalizing and externalizing behaviors in kids, which is somewhat related to depression for children, lower child well-being overall, greater paternal depression, and worse relationship quality between the parents. Okay, so paternal depression has real negative impacts on the family. Okay, so that's really what we want to focus on here, and that's why paternal depression is the outcome. So our outcome is depressive symptoms in this case. The risk factors that I'm interested in studying are chronic stress. Okay, so chronic stress basically is persistent negative exposure or experience of threat or excessive demand. Okay, so the thing about chronic stress is that it's persistent, it's chronic, it continues to happen over and over and over, right? So, stress is a natural part of life. We're all going to experience things that stress us out, right? We get in the car to take our kids somewhere, we're going to be stressed. We go to the grocery store and they don't have the thing we need, we get stressed. That's a natural part. But chronic stress is ongoing, and that's really bad for us. Examples include perhaps experiencing racial discrimination when you go out, or experiencing problems at work. Those are examples of chronic stress if they're ongoing. And then you can also live in a stressful context, right? So there are contexts that are super stressful. So one context that's very, very stressful is living in poverty, right? So living in poverty has a million issues, right? Because there's issues related to your food, your health, your mental health, your education, your neighborhood, all of these things. But also parenting, right? Parenting is stressful. it's rewarding and it's great, but it can also be stressful, right? The day you become a dad, you become a cook, a housekeeper, a planner, a chauffeur, a counselor, a bed, right? All these different roles that you have to take on. So parenting is chronically stressful. So how so? Well, one, you're never going to sleep again, okay? Particularly in that first year, right? Baby sleep schedules, they have to develop them. So your sleep is going to be affected, and that can be stressful. There's a lot of research showing that having a child impacts the relationship quality between parents, right? That's stressful. Kids are expensive, right? More and more kids are expensive, and depending on where you live, right, the cost of childcare is like astounding, right? So that's something that's super stressful, particularly if you don't have the funds. And then also, once again, you know, I have kids. Any second they can go from this to this, right? Back to this to back to this, right? You know, that's how kids are, okay? And that can be stressful as well because you're constantly trying to manage, you know, a child's emotions, and that can be stressful. And there's a lot of research in addition showing that chronic stress is not good for your health, okay? In addition to being associated with more depression, people who experience chronic stress are at greater risk of smoking, which is bad for your health, more drug and alcohol use, earlier death, more cardiovascular health problems, so more heart problems, and allostatic load, which is a score that measures, you know, the cumulative effect of stress on your body. Okay, so that's why we focus on chronic stress as our risk factor. Okay, because it's something that happens to parents, and parenting is chronically stressful, and research shows that it's related to depressive symptoms. Okay, so now the resilience resources. So really quickly, what is resilience? Okay, so I think, you know, resilience is a term we've heard a lot, and resilience generally means bouncing back after a major stressful or traumatic event, right? So it just means, you know, I you know, something happened and I was able to persevere, right? You're resilient. Resilience resources are slightly different, okay? So resources are how somebody is resilient, okay? So they enable individuals to better manage their lives, persist, and grow in the context of stress, okay? So I think, you know, we're all resilient, right? And we're all resilient in our own ways. The resources let us know which way we're resilient, okay? So let me give you just a brief example. Let's say you're in a relationship and it breaks up, and then you're really sad, okay? And then you talk to your friends, and then you feel better about it, okay? So this woman who was sad, who is no longer sad, is resilient, right? Because she was sad and she's not sad anymore, right? She bounced back after the stressful or traumatic event, okay? The fact that she leaned on her friends, right here, the fact that she talked to her friends about the situation and they made her feel better makes that social support the resilience resource, right? So it's the how, like how did you overcome it? So that's what I'm really interested in understanding the hows of how people overcome chronically stressful environments. And there are so many different types of resilience resources. There are ones related to your personality, right? So like being an optimist, that's something that is a good resilience resource when you're faced with stress. There's things related to the self and ego. So like having high self-esteem is a good resilience resource for you. Interpersonal and social ones. So social support is a very, very strong resilience resource. So having other people to lean on when you need help. Worldviews and cultural beliefs, right? So spirituality and religion for many, many people, that functions as a resilience resource because they use prayer and meditation or, you know, their religious community to help them overcome stress. And then there are behavioral and cognitive skills. So these are like kind of your coping skills, the way you react when you come across a stressor. And that is another type of resilience resource that you can have. Okay. So really quickly, just the framework for you, we're looking at chronic stress and its relationship to depressive symptoms. We're looking at resilience resources, many different ones, and how they're related to the outcomes that we care about, as well as how it's related to the risk factors, the relationship between the risk factors and the outcomes. Okay. So that's really what we study. We study stress, we study resilience, and we study depressive symptoms, particularly in dads. So I will tell you a little bit about how we've explored this in our studies. So I'm a member of the Community Child Health Network, also known as CCHN. So CCHN was a program, it's funded by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, which is an institute of the NIH, National Institute of Health, and it's dedicated to understanding racial ethnic health disparities in low-income minority groups, primarily through using community-based participatory research. Okay, so primarily this project is focused on maternal health outcomes and child health outcomes, such as preterm birth and low birth weight, and the disparities that occur between low-income women and primarily Black women in this country. And this study used community-based participatory research, also called CPR, community participatory research, which involves working together with the community through all stages of research. So this is really a community-based project, okay? And this happened around the United States. So there were 5 sites, and they were all high in health disparity. So this study happened in rural counties in North Carolina. They did studies in Los Angeles, in a suburb outside of Chicago known as Cook County. They got people from Baltimore, and they got people from DC to participate in this study. Okay, so all across the US in places that really had stark health disparities related to maternal and child health. So for this study, mothers were recruited in the hospital after the birth of the child, and then if the mother gave permission, they contacted the fathers, okay? And fathers and mothers, but we're focused on the fathers in this particular studies I'm going to tell you about, were interviewed in their homes 5 times over 2 years. 1 month after the birth of their child, 6 months after, 12 months after, 18 months after, and 24 months after. The studies I'm going to tell you about are focused on that 1 month to 12 month range because I really care about the postpartum period. Okay, so let's get into the first study. So this first study was called Risk, Resilience, and Depressive Symptoms in Low-Income Black Fathers, and it was published in Cultural Diversity and Ethnic Minority Psychology. So once again, CCHN data, we looked at these fathers across the first year of the child's life, from the first month after the birth of the child to the first year after. Okay, so our sample consisted of 306 fathers, 306 Black dads. On average, they were about 28 years old. Okay, and I want to point out that this is a very socioeconomically disadvantaged sample. Okay, so the median household income was about $8,000. Okay, so it was less than $10,000, and this is the household income. Okay, for the household for these fathers. More than half of the fathers lived at or below 200% the federal poverty line. Okay, 22% had less than a high school degree. And only 6% had a 4-year college degree, and 59% were working full-time, part-time, or were students, which means that 41% of this sample, of mostly young Black men, because these, this father-age people, were unemployed. Okay, so this is a very, very socioeconomically disadvantaged sample, but it's really important that our studies have these kinds of samples because oftentimes these people are not included in studies. Okay, so as I told you, we measured different types of risk factors and resilience resources. So the risk factors we cared about were chronic stress, which was measured with the perceived stress scale. We measured experiences of racism with the Williams Everyday Discrimination Scale, experiencing negative life events, such as did you experience a divorce? Did somebody die? Did you lose a job? As well as coping style. So avoidant coping, how do you deal with stress when it comes? Do you approach it or do you avoid it? And then socioeconomic status. Once again, we also measured less education and less income as a risk factor for greater depression. For our resilience resources, we looked at social support using the multidimensional scale of perceived social support, self-esteem, which is generally just how good or bad people feel about themselves, collective efficacy, which is about how much they feel like they have support from their neighbors and other people in their community, as well as approach-oriented coping, which is when you have a stressor, do you approach it or deal with it? Okay. And then we measured depressive symptoms. So our questions for this particular study were, which risk factors predict an increase in depressive symptoms over time? So from that 1 month to that 12-month period, what risk factors are going to make dads show an increase in depressive symptoms? What resilience resources will make dads show a decline in depressive symptoms? And do any resilience resources protect against the effects of stress or these resilience resources in these fathers? Okay, so for our hypotheses, we hypothesized that the dads who experience more chronic stress, more racial discrimination, more negative life events, who use more avoidant coping, and who had lower socioeconomic status would show more depressive symptoms. And dads who had greater resilience resources like more social support, more self-esteem, more collective efficacy, and more approach-oriented coping would show less depressive symptoms, okay, across this first year of the child's life. And that these resilience resources may protect dads from the risk factors. Okay, so for our first question, what predicts an increase in depressive symptoms across this first year? So to do this, we did statistical analyses. We controlled for earlier depressive symptoms. We entered whether the father is the father's first time being a dad, whether they're married, how happy they are in their relationship. And then we entered all our different types of stressors, okay? And what we found was that specifically fathers who reported using more avoidant coping and fathers who reported more experiences of racism showed more depressive symptoms, showed an increase in depressive symptoms across the first year of their child's life, okay? Dads who used more avoidant coping, right? So dads who, when they came across an issue, they're more likely to say, I'm not going to deal with it at this point. And dads who said that, you know, they were followed around more in stores, they were treated with less respect than others on a regular basis, show more depressive symptoms. Okay, so these are the risk factors that predict an increase in depressive symptoms. For our next question, we wanted to know what resilience resources predict a decline in depressive symptoms over time. Okay, so we did the same steps. We controlled for early depressive symptoms. We controlled for relationship satisfaction, whether it was the first time being a dad, their relationship status, and then we entered all of our resilience resources. Okay, and what we found was that none of them were significant. Okay, there was not one significant resilience resource that showed that predicted a decline in depressive symptoms for these fathers. Okay, so what resilience resources predict a decline in depressive symptoms? None. And then we also ran the interaction, the moderations to test whether the resilience resources protect from the risk factors, and none of them were significant. Okay, so these were the findings for this first study. So I'll tell you about the strengths and the limitations of this study, and then I'll get into the implications of it. So the strengths of this study, first, we were able to look across time points, right? So, you know, oftentimes with these studies, they may be cross-sectional, but we were able to see fathers, you know, across the trajectory of, you know, the first year of their child's life and how depression changes there. We looked at many different types of risk and resilience. So I really like that we didn't just look at one type of stress. We looked at chronic stress, racism, life events, coping styles, so many different types, and the same with resilience. And then we also had a large sample of, once again, very low income Black dads. Okay, so, you know, often I'll tell you, if you looked in the literature, very rarely will you find these types of samples, you know, in these types of studies. So I'm really happy that we were able to do that. Okay, however, as always, there were limitations. Okay, so avoidant coping and approach-oriented coping, unfortunately, those were only measured at the 1 year point. So those findings are cross-sectional. However, coping style is generally thought to be something that's relatively stable. That's how we've conceptualized in our study. And then also, it's always important to note that, you know, just because we had this sample of fathers, they may not represent Black dads in general. Okay, so it's particularly in this study, dads were only involved if mothers allowed them to be involved, right? So oftentimes that means they must have had some type of good relationship with the mother. And then dads only were involved if they also agreed to be involved. So this may be a sample of dads who are super, super interested in being involved and be the best dads ever. So we don't want to take these findings to think about dads generally, okay? However, in spite of those, there are still some implications this has, okay? So the first thing that struck out to me was that none of the resilience resources predicted a decline in depressive symptoms. So what my co-authors and I hypothesized was that psychosocial resilience resources like optimism or social support might not be effective in the face of overwhelming stress or barriers for poor Black men, and in this case, fathers. So once again, this is a very, very socioeconomically disadvantaged sample. Optimism is great, social support is great, self-esteem is great, but that might not be enough to cover the poverty, right, and the stress of the poverty that impacts dads. Our findings contribute to the literature demonstrating that racism is bad for you, right? So our study found that dads who reported more frequent experiences of racism had more depressive symptoms, or showed an increase in depressive symptoms, okay? So racism is bad for you. Once again, it's bad for your mental health, it's bad for your physical health. And I think, another important thing about these findings is that it shows that more research is needed on stressors and resources to fathers from diverse backgrounds. Okay, so racism in the United States, particularly, and in this study, Black men and women face it at the highest rates. They report experiencing at higher rates than anybody else, right? So what other types of stressors may impact other dads, right? Latino dads, what's something that may impact them? Asian dads, what's something that may impact them in a particular way, separately, okay? So based on these implications, came up with some solutions that we can maybe put into practice. So one, support low-income dads with tangible resources like money, food, or diapers. Okay, so we did find that none of the resiliency sources predicted a change in depressive symptoms, and like we said, I think it's because these resiliency sources can't overcome the level of stress that they're experiencing, right? The type of resource that you have has to match the level of stress that you're experiencing. If you're experiencing problems related to money and food and things like that, the solution to that is resources like money and food, right? So I think it's important that we make sure we're always doing our best to support low-income parents. Two, I think it's important that we address frequent experiences of racism as a health concern in this country, right? So as a medical professional, right, like over and over, we're finding that people who experience racism have worse mental health and have worse physical health. So it's important that we assess this and understand it. And if you're a doctor, you can say, oh, okay, so have you experienced racism lately? How's that affected you? And maybe take that into account when developing treatment plans. And last, just let's make sure that we continue to represent fathers from diverse backgrounds in family research. So we live in this country. It's a multicultural country with people from different places all over the world. So and I think it's important to make sure that Latino dads, Asian and Pacific Islander dads, and Indigenous dads and families are also represented. They have a unique experience in this country and unique stressors and unique resilience resources that protect them. So it's just important to make sure that we also include them in our studies. Okay, so that's our first study. So after that study, we wanted to better understand how does depression impact dads then, okay? And what predicts depression in dads, again, in a different way. So this study was published in Frontiers in Psychiatry, and this looks at early father involvement in depression in an ethnically diverse sample of dads, okay? And this study is the one that, they talked about it on Today's Show, it was featured on Yahoo News and CNN, and I'll tell you why in a little bit, but this is a study that we'll talk about. So in this case, we're talking about paternal involvement, okay? Paternal involvement and what it means has changed over time. Okay, so what we mean by paternal involvement in 2021 is not necessarily the same thing we would mean if we were asking about it in 2010. It's not the same thing if we were asking about it in 1980, right? In earlier studies, in the field, paternal involvement was just measured by, is the dad in the house or not? Right? Like, is dad in the house or not? And if dad was involved, we'd say, okay, he's involved. If dad was not, we'd say he's not. But we know that that's not really necessarily accurate, right? You can have a father who lives in the house every single day, but he goes to work, he comes home, and he goes right in his room and doesn't say anything to his kids, right? That person does live in the house, but they're not really involved. Alternatively, perhaps you're a father who is who's maybe not in a relationship with their child's mother or child's other parent, right? And you don't live together, but you see them regularly. You know, you pick them up. You pick them up every day after school. You hang out with them every weekend, and you do things with them, and you parent them. Well, that dad is really involved, but it wouldn't be captured by that. So that's why now we're trying to change our understanding of what paternal involvement means. So I think we have some new conceptualizations that are much better. So now we think of paternal involvement as a multidimensional construct, right? That has multiple aspects to it. First is accessibility, next is engagement, and next is responsibility. Okay, so accessibility means that is a dad accessible to his kids, right? So like, are you around your kids? Do you see your kids, right? So like being involved with a prerequisite for being involved with your kids is being accessible to them and making sure they're accessible to you. So can they see you? Can they see me? Next is engagement. How often do you engage, which is the quantity of engagement as well as the quality of the engagement, right? So like how are you parenting? What are your parenting behaviors like? Are you warm? Are you cold? Are you authoritative? Are you permissive, right? That plays a role in your type of involvement that you do. And then there's responsibility, okay? So like, do you take responsibility for things in the house, right? So like, are you able to make a doctor's appointment for your child without your child's mother or other parent calling you and saying, hey, you need to do this? Like, are you responsible enough to do those things? So that's kind of how we think about paternal involvement now. And a large body of research, okay? So we know that paternal involvement is good. So when dads are more involved, there are lower rates of infant mortality, more secure father-child attachment, lower maternal depression, and higher maternal life satisfaction. Okay, so just being involved is really good for the kids and for mothers. But the question is early involvement with an infant associated with better mental health among dads? Okay, so we know that it's associated with better outcomes for the kids and mothers, but we don't know if anybody has really explored how the involvement impacts dads themselves, right? And that's what we aim to do in this particular study, okay? So once again, we used data from CCHN and we assessed over that first year, okay, from 1 month to 12 months after the birth of the child, the postpartum period. Our participants in this study, we didn't just focus only on the Black dads, we included larger samples of dads. We had about 880 fathers, 44% Black and equally divided between Latino and white dads. About a quarter of these dads were born outside of the United States, and the majority of these were the Latino dads. On the average, they were about 29 years old. 44% were married and cohabiting with their baby's mother, while 85% lived with the infant. Okay, so this is just a little more about the sample. But once again, this is still a really socioeconomically disadvantaged sample. I still want to make sure that that's clear. So in this study, for early father involvement, it was measured at 1 month after the birth of the child. And what we measured were 3 different aspects. We asked about their time spent with infant. So we asked them on a regular day, on a regular weekday, do you spend time with your kid? Yes or no. On a regular weekend, do you spend time with your kid? Yes or no. And then they asked those same questions. Do you spend time with your kid alone on those days? So that kind of gets at time spent with infant. We looked at parenting self-efficacy. So how good does a father believe he's doing at certain parenting tasks? Like, I'm really good at changing diapers or getting bottles ready or getting those types of things ready. And then that's a type of engagement. And then material support, which is what you provide for the baby. So they ask you, like, how often are you able to provide money for clothes or provide food or provide diapers or provide, you know, all these different kinds of things that babies and families need, all right? And all these measures were used in the Fragile Families and Child Wellbeing Study, which is like a pretty famous national study of families, low income, unmarried families in the United States. And depressed symptoms was measured with the Edinburgh Postnatal Depression Scale. So once again, we wanted to know is early father involvement associated with better mental health for the parents? Okay, so to test this, first, is more time spent with an infant a predictor of less depressive symptoms? Okay, so we entered into our models and we compared dads who spent more days with their kids versus dads who reported spending less days with their kids. And this is controlling for factors such as employment, race, education, age, marital status, whether they live in a rural or a suburban or urban environment, whether they have other kids, okay? And we found that yes, dads who spent more days with their kids were less depressed a year later. So dads who spent more time with their kids a month after the birth of their child were less depressed a year later. For our next question, is greater parenting self-efficacy a predictor of less depressive symptoms? So is how good a father feels about himself, or how strong a father feels his parenting abilities are a predictor of less depressive symptoms. So once again, we entered into our models. We controlled for all the same variables: age, race, education, income, employment, marital status, rural versus urban versus suburban, whether they're a first-time father. And we found that yes, fathers who reported greater parenting self-efficacy were less depressed later on, a year later. And then, is more material support provided for the infant a predictor of less depressive symptoms? Okay, and the same thing, we entered all our models, controlled for all these variables, and we found that yes, dads who provided more for their kids, right, or who reported providing more for their kids 1 month after the birth of their child were less depressed a year later. Okay, so overview: is early involvement with the infant associated with better mental health? Yes. Spending more time with your kids, feeling better about your parenting abilities, and providing more material support, like tangible support, all was related to less depressive symptoms. Okay, a year later. So the big finding that the news organizations found was that hey, look, when dads are with their kids, they do better later on, right? So this is an incentive for dads themselves. You should really be involved with your kid. If not for your kid, if not for your child as a parent, do it for you, right? Because it's better for you as a parent if you do these things. Okay. But as always, this study does have limitations. I wish we had another measure of engagement, like direct engagement. They did ask that later on, I believe in the 6-month or 12-month interview, but unfortunately they didn't ask for that in the 1 month shortly after the birth of the child. Unfortunately, the study did not control for maternal factors, right? So I always want to point out that it is really important to know that, this presentation is about fathers and the way that fathers, influence the family, but there's no doubt that mothers influence the family as well. Okay, there's absolutely no doubt that mothers influence the family, and that maternal health and maternal mental health and maternal involvement also impacts the children and the family. Okay, that wasn't the goal of our study, so we didn't assess that, but I want to point out that we're aware of that, right? But that just wasn't the goal of our study. And then, like I said, we did control for prior depressive symptoms, but we did not assess for history of depression, right? So we unfortunately weren't able to know for that 1 month interview. It's very possible that those fathers who were super involved, right, who had the strong parenting self-efficacy, who spent good amounts of time with their kid, and who provided more material support were less depressed to begin with, okay? But unfortunately, we weren't able to really get to that. But once again, despite these limitations, these findings do have implications for understanding fathers and understanding families. So one, a father's feelings about his ability as a parent play an important role in his self-image, right? So, that parenting self-efficacy. So I think it's important to know that, like, I think dads want to be good dads, right? We want to be able to effectively take care of our kids and do those things. And we take that role very, very seriously, okay? And so much so that if you feel like, man, I'm not good at changing diapers, I'm not good at doing this stuff, it's related to lower mental health, right? Or worse mental health. So dads, right? Like, wow, dads do want to be good dads, and they do take pride in their job, right? It impacts them. Next, with regards to the material support being related to better mental health. There's a large body of research showing that, dads really relish the role of provider and protector, right? Like dads really do view their role in the family as one to be able to provide and protect for their family. If we're thinking about like caveman days, right? Like protecting your family from a tiger, right? We don't live that way anymore, right? But now that provision and protection comes often in the form of tangible support, right? And it comes in the form of money or supplies that are needed for the child, right? And we did find that that's an important one. So dads who were more able to provide felt better as well. So we want to make sure dads are able to provide. And next, fathers and entire families benefit when they spend time with their kids, right? So barriers have to be removed to allow this to happen. Okay, so like we found that dads who spent more time alone with their kids had better mental health, right? And we know just in general, spending more time with your kids and more high quality time with your kids is better for them, right? And the whole family. So we have to make sure that dads have this opportunity to do so. Okay. So what are the practical solutions based on these findings? So one, I think it's important to foster the development of dads, particularly first-time dads, okay, because they really don't know what they're doing, right? Foster their parenting skills during perhaps prenatal and postnatal visits. I can attest to my own experience, going to my now wife's, doctor's appointments when she was pregnant with our kids. And, there'll just be all this dead time and I'm just kind of just sitting there, like, what am I doing, right? In that time, right? And this is a time where dads are there. It would be nice to do some type of parenting training or skill training to help them develop those skills, right? So maybe they come into the experience feeling better, right? And feeling more able and effective at being a parent and doing parenting skills that you have to do as your child grows. Next, it's important to, I think, like I said, we want dads to spend more time with their kids, but there are a lot of barriers to that. The one major barrier to that is work. Okay, and there's a large body of qualitative research and quantitative research showing that dads actually do want to spend more time with their kids, right? They do want to spend more time with their kids, but work gets in the way. And one particular way it gets in the way is that, unfortunately, in the United States, we don't have generous paternal leave policies, right? We barely have maternal leave policies, right? So it's important to ensure that, there is paid paternal leave for parents, right? We're talking about dads, so I'm saying dads, but like for parents, right? Like none of us would be here if it wasn't for somebody giving birth to us, right? So I think it's just so important that we make sure to expand these policies, ensure that dads have a good amount of time after their child is born to be with their child, right? And in that, they'll also be able to gain more parenting skills, right? And become more effective parents and be better able to support mothers and other parents who may have just given birth, right? And that's heavy, right? So I'm all for paid paternal leave, right? More weeks of paid paternal leave and parental leave. So parents can feel more protected that they'll have their jobs when they come back, but also be able to be the best parents they can be for their young kids, okay? And these are the practical solutions based on this particular study. Okay, so those are the two major studies that I really wanted to take time to tell you about. But I also want to tell you about some current research projects that I'm kind of working on as well. So first, I completed this systematic review on adolescent fathers. So trying to understand, who are the people that become adolescent fathers and what are the outcomes of becoming an adolescent father, right? For the father himself. Okay, and what we found in this systematic review was that the teens who become teenage fathers tended to be from racial ethnic minority groups. They're more likely to be Black and Latino. They're more likely to come from low SES environments, so low socioeconomic environments, so parents with low education or low income. They tend to have parents who were teenage parents themselves, right? So there's an intergenerational aspect of it. They tend to be students who may have more trouble in school, with regard to academics, as well as actual like behavioral troubles in school, right? And there are many negative stereotypes about teenage parents, but this doesn't really fit it, right? The findings of this study, which is based on the whole literature, doesn't really fit it. Actually, this is a very disadvantaged group, right? So we need to make sure they get the support they need from us, okay? Recently this year, along with some colleagues at University of North Carolina and University of Wisconsin, we published this paper focused on COVID-19 and how it impacted Black American fathers. And what we found was that many Black dads actually reported, first of all, experiencing COVID themselves and being hospitalized for it. We're experiencing a family member who experienced COVID, was hospitalized for it, or died from it. That the COVID-19 impacted their ability to work, right? And stressed them out at work, and that all of that together, the COVID and the issues from work, related to work, impacted the whole family and the whole familial functioning and the entire familial well-being, right? Such that just being in a type of job that you're more likely to get COVID, you're more likely to have lower psychological functioning for different members of the family and lower familial well-being. Okay, so this, and this is kind of more research will be coming out about COVID-19 and how it impacted, dads and families. So I look forward to that. And then finally, here's another study, which was also published this year, which looked at disciplining and monitoring among non-resident Black dads. So, like there are negative stereotypes about teenage fathers, there are also negative stereotypes about Black dads, right? And about non-resident Black dads. Oh, they're not involved. Oh, they're not doing this. They're not doing that. Well, those are all kind of, overblown. That's not necessarily the case. But in this particular study, we were wanting to understand. We look at discipline and monitoring as an important aspect of parenting, right? Like that's a really big part of parenting, actually, right? Is making sure that, you're there for your kids and that you discipline them and monitor them so they don't get in trouble, so they do the right thing. So in this study, we want to understand what predicts that. And what we found was that dads who were more educated were more likely to discipline and monitor their children, okay? As well as dads who reported greater parenting self-efficacy, right? So the dads who, once again, feel like, I'm a pretty good parent, like I'm effective at, handling these different things that come to me. That was also associated with, more disciplining and monitoring your kids, which is, and we looked at that through a strengths-based perspective to understand that. Yeah, so this is just some of the current research I'm working on. And in general, I just want you all to know that Black dads are important and dads in general are important, and they're important members of the family unit. So I would like to thank all of my labs, the Family Resilience and Health Lab, the Stress and Pregnancy Lab, the Stanton Lab, as well as my co-collaborators and undergrad assistants at UCLA who helped me with that systematic review. Here's my email at the top. Please feel free to contact me if you need me. And here I am with my family. So once again, thank you all so much for having me.
Thank you, Dr. Bamashekvin, for a great presentation. I know I learned a lot from the studies that you shared, and those constructs that you mentioned from the second study, accessibility, engagement, and responsibility, were very helpful. It makes me think that these constructs may even serve as an outline for questions when we have conversations with fathers. So both the dads and providers are able to discern where the strengths lie and where they may need more support or education. So thank you.
Absolutely, thank you.
Thank you. So we do have some time to take some questions, and let me see if I can pull them up here. Okay, all right. So the first one is, have we seen an increase in paternal depression due to the exclusion of fathers in OB appointments due to COVID? I would also posit during labor, many of them weren't able to be there. So what are your thoughts on that?
That is a really good question. I cannot say that I have personally seen any research on that, right? But, if we're talking about it to answer the question, I think theoretically you would see that though, right? Because being there and being a part of the birth process and seeing your child there is one of the greatest experiences, and many fathers actually would like to be there, right? So the fact that they were unable to do so probably was really disheartening, especially for, some fathers who thought they were going to be there. And then last second, it was like, oh yeah, sorry, we can't do this anymore. Unfortunately, I like I said, I haven't seen anything specific to that. That's a really interesting question. I would think so.
Thank you. Thank you for sharing your thoughts. I would agree. So the second question, and I think this is referring to your first study about resilience. Do those risk factors that you shared, does those risk factors as adults equal adverse childhood experiences?
That's a really good question. So I will say that adverse childhood experiences do predict those risk factors, right? So if you've experienced adverse childhood experiences, which is known as ACEs, which are things like, unfortunately having a parent who maybe did not live inside the house, having a parent who physically or emotionally or sexually abused you, those are examples of ACEs. I just wanted to say that for everybody in case people don't know. That is related to avoidant coping later in life and depression later in life and all those things. In this case, they wouldn't be ACEs because we're looking at it in adulthood. We'll just call them risk factors or negative life events. We wouldn't call them ACEs because that C part of ACEs is related to childhood. I hope that answers the question.
No, thank you. Thank you. And I have one more question here. Did the relationship that the father have with the child's mother play a role in depression? In other words, the feelings towards that mother in a relationship versus not being in a relationship.
Yes, absolutely. So we definitely did find that fathers who had stronger relationships with their child's mother, and in this case, I want to point out, since we were focused on maternal child health, all the people in the study are heterosexual couples, mothers and fathers. This may be different for couples, same-sex couples. I want to point that out. But yes, absolutely. So if you had a stronger relationship with your child's mother, you reported less depressive symptoms. Absolutely. And one of the strongest predictors of paternal depression is maternal depression overall. So like that mother-father bond, that link really impacts the mother, the father, and the child.
Absolutely. Thank you. Actually, just let's see, one more, if you're okay with that.
Yeah,
okay.
Yeah, I'm here.
Let's see. Okay. Do you think dads or men, generally speaking, are more confused about their roles in society today?
That's a
question.
that's a question, right? I think that things have changed for parents, and I think that things have just changed for everybody, right? And if we're speaking in the context of the United States, right? The things that would fly for parenting 5, 10, 15, 20 years ago don't necessarily fly, right? And if you were raised that way, you might think that that's okay, right? But actually, we've kind of moved past those kinds of things. So I do think it's very confusing to be a father right now, right? Like and I think just generally it's confusing to be a parent. Just like what is the right thing to do? Like, what do? You don't know. But I do know that most fathers love their kids as a fact, that most parents love their kids and want the best for their kids. And yes, they may be confused, but for the most part, I think they'll figure things out and do their best to make sure kids are well.
Thank you for sharing your thoughts on that one. There are actually several other questions coming in, but I want to make sure that we keep the time. So what I can do is once we have all the evaluations, I will send you these questions, and you have contact information attached to them.
Great.
And I know that you also put your contact information up on the screen as well. So thank you for that. So in the interest of time, I just want to thank the audience for submitting, again, such great questions. Again, if you'd like to continue the conversation with our speaker, please visit Dr. Bamashigben's website at jidebam.com and feel free to contact him directly. I want to thank our Director of Education, Sarah Mueller-Robbins, and Karen Amadeo at the partnership for helping make these programs possible, the New Jersey Department of Health for their financial support, and to all of you who have joined us today. Just a reminder that in about an hour, you will receive an email with a link to a post-program evaluation, and your feedback is important, so please take the time to complete. Certificates of completion will also be sent via the email you provided on the evaluation, so make sure that is correct, and it should be received within 1 week or so. And just in case you are interested, a calendar of the partnership's upcoming virtual programs, including the recordings to all these fantastic speakers throughout the speaker series, can be found on the partnership's website at pmch.org.